mom who just had a baby and dealing with these persistent feelings of sadness that just don't seem to go away? Are you maybe recognizing that you no longer enjoy things that you used to enjoy? My name is Dr. Scott. I'm a board certified psychiatric nurse practitioner, and I'm also a third-time postpartum mom. Today, I'm talking about postpartum depression, or major depressive disorder with peripartum onset. This period of time is actually any time during pregnancy and by textbook up to 4 weeks after delivering a baby. However, you will find literature and research that suggests these symptoms can actually still be found anytime up to a year after giving birth. Some key features of postpartum depression include a mom who has just this depressed mood. She is just sad. She is dysphoric. She might be tearful, just really sad and depressed. She might also be displaying what we call anhedonia, which is just a long word for just no longer finding like pleasure or enjoyment in things that you used to find pleasure and enjoyment in. That can look like maybe every Friday, you would go to like your favorite bakery to see what their new pastry is or see what their new cookie is. And then all of a sudden, you could care less about that bakery. You could care less about the pastries that they're making. It just doesn't bring you excitement anymore. It doesn't bring you joy anymore. And this is something that maybe you consistently did for like a year. So you like it. It's an activity that brings you joy. And then all of a sudden, it just isn't anymore. The mom with postpartum depression may also be experiencing issues with concentrating. So concentrating might be really difficult. This can also make caring for a newborn really challenging. She might also be experiencing issues with her sleep. She could be sleeping not enough, so have insomnia, or what we call hypersomnia, where she's sleeping too much. She can also have kind of these feelings of worthlessness or feeling hopelessness, like she has no hope. She may also be having thoughts of wanting to harm herself or wanting to harm her baby. Not everybody with postpartum depression has all of these things. For the diagnosis, you do need to have either a depressed mood or that anhedonia that I talked about earlier. And she might also have this fatigue. Postpartum depression can actually go undetected or misdiagnosed, as issues with sleep and fatigue sometimes can just be attributed to kind of the normal adaptation or like the normal process of having a baby. But this is different. And if you feel for any reason you have symptoms of postpartum depression, it's important to seek professional help. Postpartum depression is not just stress, and it's not just hormones. There is treatment, there is support, and there is help. 9 to 16% of women who have had a baby struggle with postpartum depression. If you're struggling, reach out. Help is available. Make sure you follow along for more on postpartum mental health.